recent study found some women don't continue to get screened for cervical cancer as they get closer to 65 years old. Family medicine physician Chantel Jacobs explains when and if you can skip this important screening.
There is a lot of misinformation about women's health in general. We do have screening for cervical cancer. So it's very important for females to take that responsibility. HPV is a human papillomavirus. It is the virus that can cause cervical cancer.
In certain cases, HPV can become dormant and cause cancer years later if not detected. The average age of cervical cancer diagnosis is 50, but it can occur as late as the mid-60s. So the Pap test alone or in combination with an HPV screening test can be life-saving.
So if your Pap smear was fine at 45, it doesn't necessarily mean that it's going to be normal at 50.
In fact, more than 20% of cervical cancer cases are in women over 65. The U.S. Preventive Services Task Force recommends all women ages 21 to 29 should get a Pap test every 3 years. And from 30 to 65, they should get a Pap test every 3 years, an HPV test every 5 years alone, or co-testing with both every 5 years.
We have to be advocates for ourselves and advocates for our bodies, so we have to make sure that we stay as healthy as possible, and the best way to do that is to have an open line of communication with your primary care physician so that they can help keep you as healthy as possible.
For Millennium Medicare Connect, I'm Robert Van Winkle.